Hello, good morning. My name is Lionel Rodrigues. I'm a volleyball coach and I go speak about resistance training for young female athletes. We know that resistance training has a long list of benefits. Let's see some. Preventing sports injuries, improving muscular strength, power, and local muscular endurance, improving balance and coordination, improving bone mineral density, promoting a positive attitude toward physical fitness, improving body composition, improving metabolic health, example, insulin sensitivity. We can see in the image that other outcome of improving strength through resistant training is that its benefits transfers to all other fitness components. Balance, flexibility, muscular endurance, speed, and agility. All are dependent of strength and power. Two aspects very important. First, what type of equipment do you have access to? Full weight room, some equipment, machines, or minimal equipment, portable equipment. Bands, kettlebells, dumbbells, medicine balls, all are very important to make part of an integrative neuromuscular training program. Other aspect very important. Neuromuscular training conducted during pre-adolescence or earlier increases neuromuscular function related to improved biomechanics. One aspect is very important is that the strength and conditioning coach should be aware of the physiological differences between males and females. Some examples: an increased key angle, an increased knee valgus, and quadriceps dominance. When we speak about youth coaching, we need to speak about the athletic motor skill competencies. They reflect target movements, patterns that are component parts of fundamental motor skills and more sport-specific skills. Focus on symmetrical muscular development and appropriate muscle balance around joints. There are many movements, for example, upper body pulling and pushing into vertical on and horizontal, lower body unilateral and bilateral, concentric and eccentric, to work of core, for example, anti-rotation and bracing, to work of plyometrics, jumping and rebounding, to work of acceleration, deceleration. There are different constraints in the prescription of the resistance training. The first, is very important, is the level of coaching expertise. Other is the technical ability of the athlete. The resistance training skills competency is very important. Another aspect is the baseline fitness level of the young athlete. The availability of equipment is always important. What type of equipment do you have access to? And finally, overall goal of the training program is very important. Volleyball needs some resistance training. Basketball needs another prescription resistant training. Now we see the youth physical development model for females. This model recognizes that all fitness qualities are trainable through childhood and adolescence However, the importance of strength and movement competency as training priorities are emphasized during all the stages of development. The front size refers to importance. We see that strength is one physical quality that are emphasized during all stages of development. This model provides an overview of total physical development while identifying when and why the training of each fitness component should be emphasized. The National Strength and Conditioning Association, in the document General Youth Resistance Training Guidelines, emphasize that begin with relatively light loads and always focus on the correct exercise technique and provide qualified instruction and supervision. The concept of resistance training skill competency is very important. It not only relates to one's physical development, but also to one's cognitive ability to pay attention, follow instructions, accept feedback, and perform an exercise properly. Can be used in the design of a resistance training program. Training age refers to the cumulative amount of time spent in formalized training and is always very important. This process ends in the assessment of the competence of the young athlete using the resistance training skills battery. The resistance training skills battery provides an assessment of resistance training skill competency and includes 6 exercises: body weight squat, push-up, lunge, suspended row, standing overhead press, and front support with chest touches. Scoring for each skill is based on the number of performance criteria successfully demonstrated. As the athlete resistant skill training competencies advances, higher loads may be used in a technique-driven process, and a gradual progression of incorporating skills requiring higher degrees of technical ability may be included, for example, advanced weightlifting movements and plyometric exercises. Another concept very important is the integrative neuromuscular training. It is defined as a conceptual training program that incorporates general, for example, fundamental movements, and specific strength and conditioning tasks, for example, resistance, balance, agility, plyometrics, with the goal to improve injury resilience and to enhance sporting and motor skill performance. This training intervention model also intends to develop athletes' perceptual and cognitive abilities during sporting situations to achieve a more integrative perspective of sport performance and injury prevention. The strength and conditioning coach should be aware of the physiological differences between males and females when programming and coaching exercises. Considering that females display a large key angle than males, particular attention should be paid to technical competency in both unilateral and bilateral lower body exercises, ensuring that knee valgus is minimized at all times. Explaining the process of resistance training, including the physiological changes, potential muscle soreness, and the benefits of strength training for improved performance and injury prevention, to build a culture of confidence and comfort in the female athlete. Research has demonstrated that greater activation of the gluteus medius can be achieved through the use of unilateral exercises, which may be important for reducing knee valgus that is prevalent in females during dynamic tests. Split stance exercises have been reported to increase hamstrings activation in comparison to bilateral exercises. Don't forget that in the absence of neuromuscular training, female players often preferentially recruit the quadriceps over hamstrings muscles during activity. Researchers have hypothesized that following the onset of puberty and the initiation of the peak height velocity, core stability decreases due increased tibia and femur length, increased overall body mass, and increased height of the center of the mass. Girls may warrant additional focus on developing their upper body muscle, introducing girls to a variety of pushing, and pulling exercises in both the horizontal and vertical plane is essential in order to build upper body strength. Many girls do not enjoy upper body strength training, usually due to the fact they find it difficult or are afraid of developing too much muscle. The use of suspension training, medicine balls, or resistance bands can all be used to complement traditional dumbbell and barbell training methods to develop upper body strength. Monitor intensity is very important. We have very many possibilities. The first, repetition range represents a suitable approach. Repetition maximum target zone. Another possibility is the predication equations based in repetitions performed to fatigue with a sub-maximal load. And another possibility is the child-specific prescribed exertion scales to assess the exertional perceptions of children during resistant exercises. Two examples, Omni and PESI. This is an example of the Australian Strength and Condition Association. Repetition still fatigue is an example of prediction equation. You multiply the weight of the lift by the conversion factor. You see there are many repetitions to 1 to 20 and conversion factors for the number of repetitions. The Children's Omni-Resistance Exercise Scale contains verbal expressions along a numerical response ranges of 0 to 10 and 5 pictorial descriptors that represent a child at varying levels of exertion while lifting weights. Subjects were reminded to think about how your muscle feel prior to estimating their perceived exertion. Now we see the 1 RM, 1 repetition maximum. Research indicates that maximal strength and power testing of children and adolescents is safe and reliable when standardized protocols are implemented and monitored by qualified professionals. However, due to the time and expertise needed to properly administer 1 RM tests, in some cases it may be practical to first establish a repetition range and then change the training load to maintain the desired training stimulus. The National Strength and Conditioning Association values the plyometric training in the document of General Youth Resistance Training Guidelines. Chimera and all consider that plyometric training may improve landing mechanics, reduce valgus stress and strain, improve eccentric muscle control, and increase hamstrings activity, which may help minimize the risk of ACL injuries and in females athletes. We see the recommendations for progression during resistance training for strength. A novice refers to an individual who has no or limited resistance training experience, less 2-3 months, or an individual who has not training for several months. The intermediate refers to an individual who has approximately 3-12 months of consistent resistance training experience. And advanced refers to those individuals with at least 12 months of resistance training experience who attained significant improvements in muscular strength and power. In the table, we see the recommendations of the National Strength and Conditioning Association for progression during resistance training for power. We see novice, intermediate, and advanced levels with muscle action, exercise choice, intensity, volume, rest intervals, velocity, and frequency. To finalize my presentation, I want to summarize some big ideas. The first one is that technical competency should be prioritized always. Resistance skill training competence is very important. The second idea is that strength training is one long-term physical development strategy. Third big idea, programs were more successful in preventing knee injuries when training commenced before the onset of neuromuscular deficits. And the last big idea, well-designed training can induce a neuromuscular spurt that young female athletes may not experience through natural development. The strength and conditioning coach should be aware of the physiological difference between males and females. I hope the contents covered are useful in practice as coaches. Thanks for your attention. Thank you. Good work.